Well, I'm delighted now to be joined in the studio by Dr. Ruth Landau. She's one of the presenters from the first live session of the Andreas Hoeft Research Session, which this year is on genomics and anaesthesia. Dr. Landau, thank you so much for joining us.
Thank you for having me. What a pleasure.
So I wonder if you could start by telling us, what is the interplay between genomics and anaesthesiology?
Well, there are a lot of possible implications of the human genome and anesthesia outcomes. The first that comes to mind and has been researched quite a lot is the response to drugs that we administer before, during, and after anesthesia. So the pharmacogenomics with pharmacokinetic studies, pharmacodynamic studies. But there is much more than that. We know that perioperative outcome depend on patients' status, comorbidities, and that genomics may actually impact the likelihood of having complications related to anesthesia.
So what implications then do the genomics have for anesthesia and perioperative care and outcomes?
So that is such an important question. There was a lot of hope and quite a bit of hype with the human genome project completion almost 20 years ago, that we would be able to tailor specifically for every patient and every surgery the type of anesthetic and perioperative approach. However, the association is not that linear, and we haven't been able to really progress as much as we would have thought to offer the precision medicine or personalized, tailored approach that we were hoping for.
Is that something that could still happen?
Definitely. I think we're understanding more and more that we need to be very specific about the phenotype, so the clinical outcomes that we're looking at. We also need to be very specific at the genetic background and genomics in a larger sense, looking at the omics as well, so not just the DNA itself, but the epigenomics, transcriptomics, metabolomics, and this is where things become quite complicated.
Can you outline recent developments then in human genetics that have current and future impacts upon anesthesiologists in their clinical practice?
So one area where there has been particular research, first of all, because there is a need to avoid serious adverse outcomes related to anesthesia, is malignant hyperthermia. So this is one of the topics that we will be addressing in this session, and Philip Hopkins will be addressing the progress that has been made within malignant hyperthermia, the genomics, but this is also quite complex in the sense that it's not one gene, one outcome. So the complexities have also been that all these adverse outcomes are polygenic themselves. But I think there is hope that we will be able to identify in a better predictive manner who are the individuals that are really at risk of adverse outcomes, including malignant hyperthermia.
And just finally, there's a lot of buzz around artificial intelligence in anesthesia. What does the future of perioperative precision medicine look like, do you think?
So this is a superb question. We've made a lot of advance on the genomic side, but we also need to make progress in advance with how we integrate the information with the clinical pictures. So we need for that robust analytics, so data analytics, big data, and big cohorts with the genetic information that we have results in a lot of information that needs to be broken down and analyzed. So that's where artificial intelligence offers us the possibility to hope that one day when you come for surgery, hopefully something not major, we know exactly what we should give you, what we shouldn't give you, and what are the adverse outcomes or complications we should be aware of to try and prevent them from happening. This is called the perioptome. It's a new term that was coined, and I think that artificial intelligence should help us. Not in the near future. I think we're still a little road away from that. But we talk about precision medicine, what will it look like in 20 years? So hopefully for us, when we grow older, our children and grandchildren, we make some robust advances.
Some hope there then.
Yes, definitely. Always hope. We always need to hold on to hope.
Well, thank you so much, Dr. Landau, for joining us, and enjoy the rest of the meeting.
My pleasure. Thank you for having me.